My name is Winston, and today I'll be discussing the disease hepatitis. Hepatitis is actually a broad term used to describe a group of closely related diseases that are all characterized by liver inflammation. The disease progression varies depending on the cause of hepatitis. It can be caused by viral infections, environmental exposures, occupational exposures, or drug or alcohol abuse, or result from an autoimmune response. The discussion will focus on viral hepatitis since it's the most common cause. There are 5 main types of viral hepatitis: hepatitis A, B, C, D, and E, each distinguished by a characteristic virus. For the sake of brevity, they will be abbreviated as HAV, HBV, HCV, HDV, and HEV respectively in the PowerPoint. There are 2 major reasons why viral hepatitis exists in today's society. First, infections with hepatitis viruses have a prolonged incubation period, where the patient is both asymptomatic and still fully capable of transmitting the virus. Generally, the incubation period lasts between several weeks and several months, but the hep C virus can actually go undetected for decades. The second reason for the continued presence of viral hepatitis is a compounded infection risk. Hepatitis D can only infect someone that is either currently infected or was previously infected by hepatitis B. Figure 2 illustrates the different hepatitis viruses. Viral hepatitis is transmitted through bodily products. Hepatitis A and E are both transmissible through the fecal-oral route, where a person ingests contaminated food or water. Hepatitis A can also be transmitted sexually in some cases, though this is rather rare. Hepatitis B, C, D, and E are all transmissible through blood or other bodily fluids such as semen. These viruses are therefore prevalent among drug users and sexually active individuals. Viral hepatitis is also a global issue. All 5 viruses are globally endemic. However, hepatitis A, B, and E are particularly prevalent in poorer countries since there's less access to medical treatments and prevention. Hepatitis C is distributed more evenly throughout the world. This viral infection can go undetected for decades, so it's more prevalent in Western countries. The image to the right shows one of the main vectors for blood-borne transmission of hepatitis viruses. Etiological factors that influence the risk of transmission include hepatitis A through E can all be transmitted through either intravenous drug use or sexual transmission. As mentioned earlier, a past infection with hepatitis B puts the patient at risk of developing hepatitis D as well. Pregnancy and childbirth can also transmit the disease vertically, passed from mother to child since the viruses are blood-borne. Age has also been correlated to higher incidence of hepatitis B and C. There are also 2 main future risks for the community. Conflicts displace a tremendous number of people that often find themselves in refugee camps. These camps have poor sanitation and are often plagued by a shortage of medical supplies and services, which are both risk factors for hepatitis outbreaks. A study showed that Syrian children fleeing their country's civil war had an abnormally high frequency of hepatitis infections. The other potential cause for a future outbreak is the use of dating apps such as Tinder or Grindr. These apps facilitate intercourse with many people, and users often neglect to use proper protection. One strategy to suppress the number of cases is through vaccination. Vaccination is the most effective preventative measure against hepatitis B, which happens to also be the most virulent. Preventing hepatitis B infection will also prevent hepatitis D infection by extension. However, these vaccinations are ineffective if the patient is already infected with hepatitis B. Another strategy is to use a comprehensive approach. In New York City, the multi-level preventative strategy used for HIV/AIDS reduction was applied to hepatitis B and C infection rates. This included prevention services such as drug counseling, provision of clean needles and facilitation of safe needle disposal, provision of medical service programs for uninsured patients, expanded screening and treatment services, as well as parental support services such as housing to help avoid a drug relapse. The figure to the right shows the multi-level integrative strategy implemented to control the spread of these infectious diseases. Globally, many countries have made commendable progress in eradicating hepatitis viruses. Iceland launched the TRAP Hep C program, which provide universal access to antiviral drug treatments and expanded their testing services. Particular emphasis was placed on harm reduction, which focused on early identification and treatment of high-risk individuals, such as people that were known to inject intravenous drugs. Egypt experienced similar success by massively expanding testing and treatment availability. Children and adolescents were also extensively tested in addition to adults, and by testing adolescents, it bolstered advocacy and served to destigmatize hepatitis infections, leading more people to seek treatment. The best way to prevent future outbreaks of hepatitis is through vaccinations, as shown in the image to the right. Prevention is much more cost-effective than treatment. Hepatitis A and B have vaccines, and although hepatitis A is curable, the need for treatment may be nullified through proactive vaccination of individuals that have higher exposure risk, such as travelers. Moreover, hepatitis B vaccination inherently protects the patient from hepatitis D, compounding the benefit of this prevention strategy. Hepatitis C and E do not currently have available vaccines, which highlights the need for early detection in the case of hepatitis C, as well as the need for heightened vaccine research efforts. In my personal opinion, I support vaccinations as a first resort. The development of vaccines for hepatitis viruses should be given top priority. I also think that screening should be expanded since it would help prevent the liver failure caused by hepatitis C later in life. Furthermore, universal healthcare is imperative. As noted in the image to the right, since uninsured patients often do not seek proper medical treatment due to the astronomical costs and could easily spread the virus. Lastly, since individual behavior is difficult to control, a better solution would be to destigmatize drug users. New York City showed that providing clean needles and offering safe needle disposal significantly reduced hepatitis infection rates, and a nationwide expansion of this would have a profound impact on reducing hepatitis prevalence.